Hello everyone and welcome back to my channel, and in this video is a continuation from last week's video. So if you've not watched that one, then please click back and watch that one, because that was all about generalized adults and children social anxiety. But in today's video we're going to be talking about children in like more of a explained, deeper sense when they have anxiety. So rather than me just going through a few points, this is going to be a whole video dedicated to when children have anxiety. So let's go ahead and get started.
And trying to remain so strong, I know it's good if I'm alone. I got it,
Before I start this video, I just wanted to do a bit of a disclaimer, as I do in every single one of my videos, because I'm not a health professional. I'm not someone who is actually here to diagnose people or to give you official stuff, like official information. Although this information is taken from the NHS Choices website, so it is mainly as a purpose for people who don't really like reading a load of information, would rather sit down and listen to the information and have it in a more easily digestible format. So this is why I am here. But as I said, I'm not a health professional, but I'm here for that reason. So, social anxiety in children. It is normal for children to have anxiety on occasions, like when they're moving school, when they're starting nursery, when they're going to a new babysitter, all that sort of stuff. Normal, completely normal for children to have anxiety day before, day of, day after. But when it starts to affect every single day, it can be a cause for concern and can be actually meaning that your child has anxiety. So the signs to look out for if you have a child who you think may have anxiety is when they find it hard to concentrate. That is a big one. If they're in school and they're described as very daydreamy or very in the clouds, that might be because they're finding it hard to concentrate. If they're not sleeping, or if they're waking up throughout the night with bad dreams, that can be a sign that they've got anxiety. Eating more or less than usual, getting angry really quickly, or being in a way that means they have very out of control outbursts. If you've got a slightly older child, they may be able to verbalize some of these, but if you've got a slightly younger child, you may not. You may have to do a bit of a guessing game, a bit of guessing work. They may be constantly worrying or having negative thoughts, feeling tense or fidgety, or using the toilet more often, always crying. That can be a big one. Being clingy, especially with young children, or complaining of tummy aches and feeling unwell can be a more physical sign of a child who has anxiety. As someone who is a parent or someone who looks after children, you may be wondering, how can I help this child with anxiety? And it's important to talk to that child about how they would want the support and how they would want the help. If they're too young to do that, try experimenting with different techniques and find the one that they respond to the best. So many children at different ages have anxieties that will go away after a while, especially with some reassurance. However, it is a good idea to seek help from your GP if you're in England, if they are not going away or they're becoming worse. If self-help is not working, and if it's affecting their school, family, life or relationships, it is important to seek some help. Where to get help? As I said, your GP is a good place to start. You can talk to your GP on your own or with your child. You can book the appointment for your child and only you turn up, or you can book the appointment for your child and both of you turn up. If your GP thinks that your child may have an anxiety disorder, they will probably refer them for an assessment with your local children and adolescent service to help them to get a better picture as to what type of anxiety, because there's all different types of anxiety. So if your child does not want to go to a doctor, they may be able to get help directly from a local youth counselling service. There is a link on this page. If you click on the link in my description box down below, it will take you to the NHS page about anxiety disorders in children, and then you can read along with me, or you can scroll down to where it says where to get help for anxiety, and you'll be able to click on the link directly rather than me quoting it on screen and then you having to type it in and all that sort of stuff. It'll be a lot easier. I've got to leave that one link in the description box and you can click on what you think applies to you. The next thing I want to talk about is treatments for anxiety disorders in children and young people. So counselling is a really, really good service that can help your child to talk about things that may be worrying them and give them the support they need. If they feel that they need CBT is cognitive behavioural therapy. It is usually given to people who have anxiety as well, even in adulthood, and so it may be helpful for your child as well. But having childhood-based CBT is important to make sure that the CBT is tailored to your child and not just generalised CBT. Anxiety medications can be offered to children when it is very severe and if it doesn't get better, but usually this is a last resort for children. So now you may be thinking, what causes anxiety in children and young people? Well, having a close family member who had anxiety or has anxiety may cause your child to have more chance of developing anxiety. Children can also pick up on behaviour from their surroundings. So in the nature versus nurture, nature would be the actual genetics and the way that it's passed through down the generations, and nurture would be them picking up on the signs from their environment. And if mum is really, really anxious all the time, then it could be something that causes your child to be like picking up on that behaviour and think it's normal to have that behaviour. Some children may develop anxiety after stressful events, such as frequently moving house or school, parents fighting or arguing, the death of a close friend or relative, problems becoming seriously ill for themselves or for a loved one in an illness or an accident, school-related issues such as exams or bullying, and being abused or neglected. And when we talk about that, I want to talk about quickly 2 different cases that have happened recently. I'm not going to go too deeply into them because I think they do deserve their own video, and I will leave links and descriptions for like these people I'm going to be talking about, but I've seen them on my social media. There was a 13-year-old girl who took her own life after bullying, and there was also a little boy who I think was 8, and he's in the UK, and he took his life following bullying. And it's becoming something that bullying should never be happening. If you're a bully, stop. Like it never results in a good outcome. Like you may not like someone, but my grandmother, who's no longer with us, used to teach me that if you don't have anything nice to say, don't say nothing at all. Just walk past that person, you know? It can be very hard for a person on the receiving end to deal with that. So it is important that bullying is never a good thing, you know? Deal with your own demons that are causing you to bully, or think about the reason why you're bullying that person. I know bullying happens and it's always going to happen, and there's never going to be a complete eradication of bullying, but please think about the other person. If you're somebody watching this who has a child who has been accused of bullying, maybe just talk to them about the side effects for the other person. Try and get them to understand that the other person, I was on the receiving end of bullying when I was in school, and it caused me a lot of heartache and a lot of issues when I was in school, and I started having symptoms of my autism like very early on in my childhood, and I got bullied, not for my autism because I didn't know I had autism until literally this year, but being bullied can really cause a lot of heartache and disappointment and struggles for the receiving end. So if you have a child who's being bullied, fight for them, advocate for them. If you've got a child who has been accused of bullying, try and sit down with your child and try and get them to understand the repercussions for the other person that they are bullying. Because being accused of being a bully is quite a hard thing to deal with, and I don't know what I would do. I think if I was a parent, I'd sit down with my child and I would try to get them to understand how the other person might feel, because I, as I said, was bullied myself, and I really do get the full repercussions of that. Another reason that your child may have anxiety is what I've just talked about. It's me. This is children who have attention deficit hyperactivity disorder, which is ADHD, or children who have autism. That is me. Basically, I haven't been diagnosed with ADHD, but I've been diagnosed with autism, and it was put in my assessment that I had traits from when I was younger. So, yeah, if your child has autism and has been diagnosed as being autistic, or you think they are, then get some support for that, because I never received any support. It was never picked up on me as a child because I highly masked. So if you look down in my description box down below, there'll be a link to this page, which is the NHS page, all about children who have anxiety. And it may give you some ideas. You can literally read it along with me as I'm talking about it. And there's 2 sides of A4, which is literally not very hard, not a lot to read, I should say. It's not a lot to read, and it gives a lot of links throughout that may be of some benefit to you or your child. So I wish you all the best. But that is it for today's video. Thank you very much for watching, and don't forget to like, comment and subscribe, because it all means a lot to me, but it also means that this video could be pushed out to more people that might even benefit from this. So if this is not something that you've benefited from, it would be great if you just like it or interact with it in some way in order to help other people who might benefit from this video to see it. But as I said, thank you very much for watching, and please don't forget that I believe in you even if nobody else does. And I shall see you in my next one. Bye.
Just like you're young again, no, don't you cry. Just get back up again.